Previously, we looked at the natural ways to preserve your prostate glands. Now, in this video, we are going to discuss the symptoms of an enlarged prostate, also known as BPH. Now, BPH normally occurs when the prostate gland grows large enough and it starts pressing over the walls of the urethra. Now, this may cause noticeable symptoms, especially in men who are aged over 50. Now, let us begin with the first storage symptom, which is frequent urination. Frequent urination is also known as polyuria. Now, in this case, the bladder becomes more sensitive to frequent urination during the day, and the bladder cannot hold much urine as before. This is because the bladder becomes more sensitive and hyperactive. Night urination is one of the earliest and most bothersome symptoms of enlarged prostate. Now, another storage symptom of enlarged prostate is urination dribbling. Now, urination dribbling refers to the loss of urine as some of the urine remains within the urethra during urination. Now, this symptom is very common in old men with the enlarged prostate symptom and also in some young men with tight pelvic floor muscles. Now, this symptom may not be very dangerous, but it can be treated with perineal massage and also pelvic floor exercises. Following are the causes of urine dribbling. So the first one is post-void dribbling. Post-void dribbling occurs when during urination, some of the urine remains within the urethra. Now, the second cause of urine dribbling is enlarged prostate. Now, as the prostate gland continues growing, it starts pressing over the walls of the urethra. Now, when it presses over the walls of the urethra, it causes constriction of the urethra, and sometimes it may cause complete blockage of the urethra. Now, another cause of urine dribbling is weak pelvic floor muscles. Weak pelvic floor muscles may be caused during childbirth, or it may also develop as a person ages. Another cause of urine dribbling is tight pelvic floor muscles. Sometimes the pelvic floor muscles are very tight. Now, this may prevent complete relaxation and therefore in the process may trap urine in the urethra. Next, let us look at the treatment and management of urine dribbling. Now, the first one is pelvic floor exercises. Now, this refers to the long and daily exercises that involves long and quick squeezing of pelvic floor muscles. The second technique is perineal massage. Now, this technique is highly recommended for men and it can actually help. Now, another method of preventing urine dribbling is through lifestyle changes. Now, we can do this by limiting alcohol and caffeine, which are actually bladder irritants. Now, this method is also a proven way that can actually help to manage your symptoms. Now, the last method of preventing urine dribbling is by weight management. Now, maintaining a healthy weight can help to reduce the risk and severity of urine incontinence. Now, you are advised to see the doctor if dribbling is frequent, bothersome, or is accompanied with other symptoms. Now, the second symptom of enlarged prostate is urination urgency. Now, urination urgency refers to the increased sensation of the need to urinate. Now, urination urgency is caused by the enlarged prostate gland pressing over the bladder. It increases bladder sensitivity. So this one leads to increased urgency to urinate. Now, in this case, the bladder becomes even more sensitive to the little urine that is stored in it, so this leads to increased urgency of the need to urinate. Now, this happens during inconvenient times of the day or the night. Now, another symptom of enlarged prostate is weak urine stream. Weak urine stream is a direct symptom of enlarged prostate. Now, as the enlarged prostate presses over the urethra, it constricts the urethra. Now, this may require the bladder muscles to work extra hard so that they can push the urine through the urethra. Now, since our urethra is constricted, we shall have a reduced force of the urine flowing through the urethra. Now, the next symptom of enlarged prostate is urine retention. Urine retention is caused by four major factors, that is bladder muscle weaknesses, bladder muscle constriction, so urinary retention itself. Next on the list is discomfort-related symptoms. An example of discomfort-related symptom is burning sensation. Now, it is important for you to note that burning or painful sensation is not a direct symptom of enlarged prostate. However, it can be associated with other prostate-related conditions such as prostatitis, that is inflammation of the prostate gland. Now, let us look at how an enlarged prostate can cause painful urination. An enlarged prostate can cause painful urination because of its impact on the urinary tract. Now, the following factors can cause painful urination. The first one is urine retention. Now, excessive pressure on the bladder can prevent bladder from emptying completely. Now, this can cause pain from the backed up urine. Now, the second factor is UTIs. UTIs means urinary tract infections. An enlarged prostate can cause someone to be prone to UTIs. This may cause painful or burning sensation during urination. You also need to know that inflammation of your prostate gland, also known as prostatitis, can also cause painful urination. It is important for you to note that inflammation of your prostate gland, also known as prostatitis, can also cause painful urination rather than PPH alone. Another symptom of enlarged prostate is incontinence, which refers to the leakage of urine from your bladder as a result of poor bladder control. So the next on the list is complication-related symptoms of enlarged prostate. So number one is inability to urinate. Now, as the person grows at around age 25, the prostate gland starts to grow. So it can grow long enough such that it reaches the walls of the urethra. So in the process, it can end up blocking that particular urethra. There are two major types of inabilities to urinate. So the first one is acute urinary retention and the second one is chronic urinary retention. Acute urinary retention refers to the sudden loss of ability to urinate. So this is an emergency case and it might require immediate medical attention. It is often accompanied by a significant discomfort or pain in the lower part of the abdomen. On the other hand, chronic urinary retention refers to a situation where we have a gradual loss of ability to urinate. Now, in this case, the patient is able to urinate, but they can retain some little amount of urine within the bladder. Now, over time, it can easily lead to weakened bladder muscles, and in the process, it can also damage your kidneys. Now, the next complication symptom is hematuria. That is the appearance of blood in the urine. Blood in the urine can be number one, gross hematuria. So gross hematuria means it is visible, or it can be microscopic, which means it can only be detected by laboratory tests. Now, while this one is a possible complication of enlarged prostate, hematuria is not as common as other symptoms of enlarged prostate.